Hello. So President Trump nominated another CDC director this week. Meanwhile, a child in South Carolina is in the hospital right now. And this is not in 1952. This is right now this week. And the agency that is supposed to stop that, the CDC, has been through repeated leadership upheaval for the past 15 months.
And so today we're going to talk about President Trump has just now nominated his third CDC director, and her name is Dr. Erica Schwartz. And you need to know who she is. And, she's walking into something that may be a little bit chaotic, definitely disruptive. But what happens to her if she cannot stabilize this agency already under extraordinary strain?
I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. And so today's episode is about the nomination. But it's also about what happens when an agency has lost its stability and whether or not one doctor has the judgment and the courage to rebuild that trust. So we're going to be talking about Dr. Erica Schwartz, who she is, what she's walking into, and what you need to know and watch for during her Senate confirmation hearings, because what happens next is going to affect all of us. So let's start with the facts. Dr. Erica Schwartz holds a medical doctorate degree from Brown University, 8 years of liberal arts from medical education training, along with a law degree and a master's in public health. I mean, she is definitely qualified for the position. She spent more than 2 decades in public health, the U.S. Public Health Service Commission Corps, and she's already also served as the Navy, rose to the Rear Admiral in a short amount of time and became the Coast Guard's chief medical officer. So in that role, she oversaw a large network of medical facilities and helped shape pandemic preparedness, the policy, before COVID became a household word.
So during Trump's first term, she served as Deputy Surgeon General of the United States. After that, she largely stepped out of public view. On paper, this is not just a lightweight pick, right? Those credentials are serious. The operational background is real. And the question is not whether she has experience. The question is whether that experience is enough for what she is being asked to lead right now. And I want to be clear about something. What I'm about to tell you is based on the public record and current reporting, not speculation. Because since January 2025, the CDC has not had a long stretch of stable, permanent leadership. This agency has been through a rapid series of changes at the top, and that really matters.
Yeah, remember the first nominee was former Congressman Dave Weldon, and he withdrew before his confirmation hearing even began. And then the second person was Dr. Susan Monarez, that was the career public health scientist that we really did want. She was confirmed and then removed because why? She clashed with RFK Jr.'s policy over vaccines, remember? And then the public record around Dr. Monarez's removal is not about incompetence. She was definitely, the person they probably needed at the time. It was whether the scientific judgment and political pressure can coexist inside the same agency. And so after Dr. Monarez acting leadership signed off and stepped down, major changes affecting what? Childhood vaccination policies began. And those changes were later what? Challenged in federal court.
And this is not a normal transition. That is not steady governance. This is real instability. And in the background, measles has come roaring back.
Yeah, and we're not talking about it, right? It's not in the press anymore. So the CDC data released earlier this year showed thousands of confirmed cases in 2025. And the outbreak has continued into 2026. We're in April now, and it's rip-roaring, as you say. The risks are no longer theoretical. So a former CDC chief medical officer, Dr. Eb Ori, who resigned later this past year, described an agency around 20 political appointees, some that were known, documented anti-vaccine views, controlling external communication and contracts. And now that's the agency that Dr. Erica Schwartz has been nominated to lead. Who is her colleague in public health? RFK Jr. Let's roll this clip.
Now, one thing that I find incredible is that you suspended this pro-vaccine messaging campaign, but somehow you're spending taxpayer dollars to drink milk shirtless in a hot tub with Kid Rock. And somehow you think that's a better public health message
Your time is
than
expired
informing
by a
the
minute.
public about the importance of vaccines?
Gentlelady's
Really?
time is expired.
Really? I yield back.
You don't have anything to yield. Mr. Smucker.
You can't make this stuff up. I'm serious.
You cannot. And it's accurate, right? She's not telling an untruth. So here's what public health teaches us over and over again, right? When prevention gets weakened, the people who pay first are the people with the least protection. And that includes Black and brown families, low income families, and places where access to care has already been fragile for years. And we recently spent $630 million in 48 hours for some military pre-strike operations. And this is all while the CDC vaccination infrastructure was defunded. And someone was sitting in a hot tub, right?
with the shirt off. Milk does the body good. So when vaccination systems weaken and the outbreak does not stay in one place, which it's not going to, it spreads into schools and homes and clinics and the emergency room. And the communities least equipped to absorb that, of course, absorb it first. So public health is not an abstract. It's a daily infrastructure question of who gets protected, who gets seen, and also who gets ignored, of course. And while outbreaks are spreading, our government still finds massive sums of money and other priorities, like almost overnight, with no government or congressional approval.
And so this is why that contrast matters, right? The childhood immunization program serves millions of American children. The cost per child per year is small compared with what outbreaks cost in hospitalizations, in missed work, in preventable harm, in lives. So when we talk about who leads the CDC, we are not talking about a bureaucratic appointment. We are talking about whether parents can trust the guidance coming from the government that's based on science and not political convenience.
Yeah, we're talking about whether the long game, right? Dr. Daskalakis is warning us about, has already started. Now, we want to give you the full picture because here on MeidasTouch, we deal with simple narratives. So there are Republicans, including some who are deeply uncomfortable with where Kennedy has taken this health policy, who see Schwartz, Dr. Schwartz, that is, as a stabilizing choice, right? They want to reset. And that does matter. But it also means expectations are extremely high and scrutiny is going to be intense because the last director who tried to protect scientific integrity was removed.
And so we do not know yet where Dr. Schwartz stands on the most contested questions. Her public record on childhood vaccine policies changes. That's very limited. We do not know how she'll respond if political pressure conflicts with public health evidence. We do not know whether she will protect the scientific independence of the agency. So those are not gotcha questions. These are questions that will tell us whether she can actually lead.
And we have to just sort of wait and watch. Well, watch and see, right? So when she sits before this Senate Help Committee, here's what must be answered. Number one, what specific actions will she take in her first 90 days in the middle of this measles outbreak, right? Number two, does she believe in recent changes in the childhood vaccine policy and if they were grounded in scientific evidence? Number three, if directed to suppress or delay public health data, will she? Because that's what RFK Jr. and or Trump will probably advise. And then number four, how will she rebuild this trust with the public health scientists who've been fired, resigned, or silenced? And lastly, how does scientific independence, what does that mean to her? And how is she going to protect that from the Trump administration?
And those are not gotcha questions. They are survival questions for an agency that is running out of time. Here is where we land. Dr. Erica Schwartz brings some of the strongest traditional public health credentials of anyone this administration has put forward for this role. And that is real, and that matters. But she is being nominated to lead an agency that is already under intense pressure in the middle of renewed outbreaks with trust in vaccines and public institutions badly damaged.
And I'm going to say it because no one else is, but it's going to take a Black woman, a disruptor, to say it. They want a Black woman to fix what they've messed up. I'd use another word, but we're, public, whatever. Yeah. So the credentials that cannot be verified by just a resume, the one that matters most right now is her courage. The courage to say no when science demands it, the courage to protect the institutions bigger than one appointment, the courage to remember who is watching. And the people watching tonight and parents checking their child's vaccination records are up to date. That's what matters. And she's up against a huge, surmountable infrastructure right now.
So these are public health workers in Atlanta wondering whether their science will be protected. And they are all of us. So you should check your family's vaccination records tonight, not tomorrow, but tonight. You want to call your senator's office this week and ask those 5 questions, because we will be watching and we will be reporting. But before we go, we need to say a name. Dr. Serena W. Fairfax, DDS, dentist, mother of 2, member of Alpha Kappa Alpha, Sorority Incorporated.
Yeah. She was murdered yesterday by her husband. This is what we call femicide, and that is a word. And the research is clear. Women are the greatest risk of lethal violence when attempted to leave a situation. And the leaving is the most dangerous moment.
So Dr. Fairfax deserved to be safe. Her 2 children deserve their mother. And we say her name, Dr. Serena W. Fairfax. So someone you love is in danger, you should call or text the National Domestic Violence Hotline, 1-800-799-7233. That is 24 hours.
Yeah, you're not alone. Definitely reach out. And we will be here every week telling you what doctors know and what people in power hope you will never find out. So stay tuned, stay empowered, stay disruptive. And remember, your voice does matter. We're AYA, contributors to MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Bye, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.